Hi, my name is Ann-Kathrin or AK Eisfeld. I'm currently an assistant professor in the Division of Hematology at The Ohio State University, and I'm also the co-director of the Clara Bloomfield Institute for Leukemia Outcome Research. And I'm excited to talk to you today about the question whether race is an impacting factor on the outcome of AML or acute myeloid leukemia patients. And I'm basing my answer to this question on the results of a study that we recently conducted here in the US that was done on a population study where we were looking at patients treated over 3 decades in the US, and then specifically at a smaller cohort of a little bit more than 1,300 patients that were treated within clinical trials here in the US, which gives a little bit additional information. And what we were able to find, and which is confirming what other people found before us, was that indeed, being African American, being what we look specifically at non-Hispanic Black patients, is that those patients do poorly compared to white or non-Hispanic white patients diagnosed with leukemia. We believe that there are different reasons for that, some of them which have been found before, and some which are new and based on the findings of our study. What has been shown before was that like Black patients with leukemia live shorter, and this is true, especially for patients diagnosed at a younger age. And I'm referring at a younger age for patients who are younger than 60 years. And this is especially sad because this is a patient population where we hope that those patients should be able to be cured from their disease when we use conventional chemotherapy. And our findings show that, yes, one part of the reason that that Black patients do worse than white patients is probably factors associated with income, household income, and access to care. But another so far unknown reason is that factors which we as physicians know, like biologic factors of the leukemia itself, seem to be different between Black and white patients. This is something that has been underappreciated before and that really has to be studied in the future in order to really do a patient-centered addressing of the disease so that we can treat the leukemia of every patient in the best possible way.